Lecture 17, the science and the art.
Up to this time, we have been studying principles that relate to the knowledge of homeopathy. At this point, Hahnemann arrives at three important conclusions as to what we have been studying in application to practice. There are three steps to be surveyed. Up to now, he has explained about the science. Now he is explaining about the art. What is the difference? Applying science into art. First, by what means is the physician to arrive at the necessary information relative to a disease in order to be able to undertake the cure? Of course, that relates to the disease in general and the patient in particular. In going over the third paragraph, we gathered together the means of studying an epidemic and each man in particular. We shall now proceed to study disease in general and the patient in particular from now on to the end of this course. Studying the disease in general. That means we can know it better when we read about the prevalent epidemic. Suppose there are fevers, seasonal fevers will be there. Seasonal sore throats will be there. So as a general rule, what are the symptoms that we can identify in the beginning itself that we can know about the disease? But now it is not enough that if we know about the disease in general and prescribe to the patient. In each particular patient, we have to study the patient in particular, not only in general way. But how it helps, the general way, how it helps means, in the first few cases, we may miss the diagnosis and the prognosis and also the what are the manifestations, what is going to be done in the case, how it ends, how it develops, and sometimes in certain diseases of acute infections, in first 2 or 3 cases, we may miss the condition. But after seeing a few cases, we can know, yes, this is also the same case. In the beginning itself, we can know that this is also going to develop into this type of sore throat or pharyngitis. In some cases of pharyngitis and in some acute conditions, if we are unable to diagnose in a given particular time, the case may advance or we may lose the case. If the patient goes to another physician, no problem. He may diagnose better. But it is very important in acute cases to know as early as possible about the case in general. We shall now proceed to study disease in general and the patient in particular from now on to the end of this course. All the rest of the study is of such a character. There are a great many questions that arise in this problem that must be studied in detail. The study of the nature of acute miasms and the study of the nature of chronic miasms. The study of such changes as show there are two distinct classes of sickness. Each one is to be studied in its most general way and each person as a particular entity. Number 2. Second is, how is he to discover the morbific powers of medicine? That is to say, of the instruments destined to cure natural disease. This constitutes a study of materia medica and a knowledge of how it is built, which is by proving, by recorded facts, only by studying materia medica. Of course, in chronic cases, it is no doubt, it will give some time. But in acute cases, the time will be very short. So we should be able to decide the remedy also in a very speedy way in acute cases. Speedy way means actual remedy. ఏదో తోచిన రెమెడీ కాదు. Any disease, any remedy, trial and not on trial and error basis. Only the indicated remedy we have to give as early as possible, which can only prevent advancement of the disease and also which can only cure the condition. Otherwise the condition will be aggravated and it will advance and the condition of the patient will be worsened. For example, in chronic cases, if 2 days is delayed to give an accurate remedy, no problem. Or 1 week is delayed, no problem. The advancement of the disease will not be so fast. But if the fever is 104 or 105 Fahrenheit, if we are unable to give the correct remedy, not that the fever should come down, but the patient should be cured and then the fever will come down. Third, what is the best mode of applying these morbific powers, medicines, in the cure of diseases? This involves the study of all methods and settling upon that which is best. To proceed in the study of these in a rational, scientific and careful manner is the object of the future study of this book. It leads for now on from this science of homeopathy to the art of healing. We see that we have now gone over the principal part of that which is merely science, the science of homeopathy. We have none of the enormous classifications of the study of homeopathy that are resorted to in traditional medicine. They should not appear in the study of applied homeopathy. To what disease which medicine is required, for so and so disease which medicine will work. In that way we should not remember. We should not search in that way. The study of the classification of disease as is done in traditional medicine is useful because we come in contact with the world. No doubt we have to study the nature of the disease for two important things. One is for the sake of the world. What is your diagnosis, doctor? What do you think? The patients may be asking, what do you think? What is your diagnosis? Because they are more educated because by the means of the internet and all these things, they are able to grasp about the nature of many diseases. So what is your opinion? What is your diagnosis? And why I got this? Why should I got this? ఎందుకు వచ్చిందండి అంటారు. అది నువ్వే చెప్పాలి ఎందుకు వచ్చింది, ఏం చేసావో ఎందుకు వచ్చిందో నువ్వే చెప్పాలి. ఏం తిన్నావో, ఏం ఆలోచించావో, ఏం చేసావో అవన్నీ నువ్వు చెప్పాల్సింది కదా ఆన్సరు. అంటే వీ షుడ్ ఎలిసిట్ ఫ్రమ్ ది పేషెంట్ వై ఐ గాట్ దిస్. When he asks, for that we have to elicit the answer from the patient himself. Why he got that problem? Because of his ill behavior or ill behavior in diet, in his routine, in his sleep. What happened? And second one is not only for the sake of world. Second one is to know the prognosis of the disease, prognosis of the patient. If we know the nature of the disease, we can know in what stage the patient is. How can we inform them? For example, if a patient comes with an advanced stage of cancer or advanced stage of tuberculosis, he asks, can you cure it? Can I be cured completely, doctor? If we do not know about this stage, we can say, no doubt, we can cure with homeopathy. But if we know about this stage, if it is in the third stage or final stage of cancer, we have to advise the patient, we have to inform the patient that we will only try, yours is an advanced condition. If you want to continue the case treatment, you can continue. We cannot assure about cure. We can try, if the medicines will work, then only we can say how far you are going to improve, how far you will survive. That we can say only after the application of medicine, how the medicine acts, then only we can say. This we can explain to the patient when we know about the prognosis of the case. Blindly we cannot, we should not say that no, you can be cured. Or suppose if the case, if we did not study the case, we do not know the prognosis. If the patient came and we have noted down the case and he explained about in the early morning, exactly he explains. Morning stool rises him from bed. Early morning stool. He runs. So after seeing the symptom, we may be tempted to prescribe sulfur. Because we did not study the case in a proper way, the patient already he had suffered with severe tuberculosis of the lungs, and also he had cavities in the lungs. Only basing upon this symptom, if we prescribe sulfur, after some time what happens? He starts vomiting blood. He cannot understand why it is happening. He is better in his morning diarrhea. So because of to know all these things, to know the prognosis, we have to know the general state of the disease also. What is the condition, in which state he is, that also very important. But not for the sake of prescription. That he emphasizes. The knowledge of the disease, it will not help in any way for the prescription. As the boards of health requires us to state what particular disease according to classification a patient died from, classified in accordance with the old school nosology, we have therefore to go into the study of diagnosis. So if the patient dies, how can you diagnose? What will you say? With what he has died? Why he has died? Suppose the patient is improving well. He got an acute condition. After your treatment, he is improving well. Suddenly he collapses sometimes. Why? What happened? Due to sudden, there may be a correlation, but not due to the disease and the treatment. If a patient dies due to sudden cardiac arrest, in any situation it may happen. Recently, one patient, she was telling that one of her relatives, while explaining in the class, he was writing on the board. Suddenly he got attack and fell down. Sudden cardiac arrest. Recently, 2-3 days back, one patient said that. So, if a person gets sudden cardiac arrest after improving from the acute disease also, you should be able to know why he has died. What was the cause? If you do not know about the condition, you may think that while convalescing from the acute disease, the patient have died due to weakness. But not due to weakness. Sudden cardiac arrest, the patient has passed away. So that you should be able to explain. In homeopathy, diagnosis cuts very little figure in the treatment. But all the ultimates in the case must be brought forward and described by name. It will not in any way, definitely it will not help for the sake of treatment. But we should be able to know, to explain about the condition, to inform about the condition, to know about the condition. For all these things, you should be able to know. We want the use of adjectives. We want the use of large language. We want a descriptive power in order that the nature of the sickness, which is all the man can know about the disease, may be brought out on paper and thereby caused to appear at any time thereafter to the mind of the physician. Everything you have to write on the paper. మరి మల్టీ స్పెషాలిటీ హాస్పిటల్స్లో వాళ్ళు అదే రాస్తాడు కదా, వచ్చినోడు జాయిన్ అయినప్పుడు ఏదేవో రాసేస్తాడు. పేషెంట్కి ఏమైనా రాస్తే at the time of discharge the patient is అని రాసి అక్కడ రాసేసి ఇగో ఈ మెడిసిన్స్ ఇచ్చా. ఆ లాంగ్వేజ్ ఎలా అయితే దాంట్లో ఎలా ఉంటుంది వాడి లాంగ్వేజ్, వాడి మీద ఎక్కడా కూడా వాడి తప్పు ఉండదు. If the physician were simply to make a study of the disease and after studying it were to give it a name and let that name constitute the record, no future prescription could be made, and the physician thereafter in referring to this record would know nothing about its nature. The name conveys no idea of the nature of the sickness, only its place is a general classification. హోమియోపతికి అది ఎంతవరకు ఇంపార్టెంట్ అనేది అంతవరకు తెలుసు. A knowledge of the nature of the individual sickness is necessary for a prescription, and this depends upon the ascertainment of the details. The very first of this study is to prove and realize that there are two classes of diseases, acute and chronic. The general classification of all diseases is made in this way. The acute are thrown into one group and studied as acute diseases, and so with the chronic. An acute miasm is one that comes upon the economy, passes through its regular prodromal period, longer or shorter, has its period of progress and period of decline, and in which there is a tendency to recovery. There is a tendency to recovery, another. And if the doctor can utilize it, the patient will recover. If the doctor can treat well, this tendency can be utilized well, the patient recovers. If he cannot treat the case successfully, this will be this third stage will be the end of the patient. A chronic miasm is one that has its period of prodrome, period of progress, and no period of decline. It is continuous, never ending, except with the death of the patient. Ante chronic diseases ante kada, unless it is properly treated, it cannot be cured. For acute disease, even though there is no treatment is given, if the person's health is strong, if he is vigorous, even without medicine he may recover after its period is past. Prodromal period, period of progress, and during period of decline, when its course is completed, if the patient is strong and previously if he is healthy, he will recover even without treatment. But in chronic diseases, he will not recover unless proper treatment is given. He will not definitely recover. Period of prodrome will be there, period of progress will be there. But period of decline is only with the death of the patient in chronic diseases, unless proper treatment is given. The acute diseases need much less study than the chronic. They are all such as are contagious or infectious, such as have a miasmatic character and are capable of running a definite course. When man disorders his stomach and has an attack of vomiting, and from which he has no after trouble, he has suffered merely from an indisposition. Why he gets vomiting? First is also correct. If he takes an unwanted thing or eats more, definitely to save him, it will be thrown out. And also in food poisoning also he suffers from vomitings and motions. Why? Otherwise, if it is inside, he will definitely die. If it goes out, he may save. Even without treatment also, if he completely it goes out, he may save. If he gets the treatment, no problem. Definitely he will save. Such conditions from external causes are not miasm. They are only indisposition. For example, a person is playing cards in the night or chit-chatting. Friends are chit-chatting up to 3 o'clock in the night. Morning, after waking up, he gets a very restlessness, body pains, very weakness. Everything will be there. Why he got? The cause is only delayed sleeping in the night. So this is only indisposition. Otherwise, he has gone to second show cinema. That cinema is a very big old cinema. ఏ మాయా బజారో లేకపోతే పాతాల భైరవో ఏదో చాలా పాత సినిమా దాకా వెళ్ళాడు. వచ్చేసరికి రాత్రి 5 ఇంటికి వచ్చేసరికి 3 అయింది. అప్పుడు పడుకున్నాడు. మర్నాడు వచ్చేసరికి బద్ధకంగా ఓడి నొప్పులుగా కళ్ళు తిరుగుతున్నట్టుగా ఇవన్నీ ఉంటాయి. ఇవన్నీ డిసీజ్ కాదంటున్నాడు, ఇండిస్పోజిషన్. మర్నాడు ఇంకో 2 hours పగలు రెస్ట్ తీసుకుని వాడికి ఏమైనా సెట్ అయిపోతుంది. వితౌట్ మెడిసిన్ ఆల్సో దే విల్ సెట్ రైట్. If he has eaten more in the afternoon, in the night if he observes fasting, by next day he will be normal. So all these are the indispositions. Things that go through the mouth into the stomach and thereby produce sickness act either as rousers up of some old trouble or as a mechanical causes of disturbance. The pure disease, on the other hand, whether acquired or inherited, are those that flow from the innermost to the outermost while making man sick. So therefore, the difference is in the previous first condition, the things go from mouth to stomach, and they will cause the sickness. If the sickness may be acute due to the items which has gone inside, or they will disturb the economy and they will bring out the old disease. The second thing is innermost is affected and slowly the outermost is affected, either inherited or acquired. These causes that make man sick are influx of simple substance, and they run a fixed distinct course. Each one has its own period of prodrome, its own period of progress, whereby the traditional school of medicine has fixed what it calls pathognomonic symptoms. It is well to know these symptoms, not for the purpose of naming merely, but for the purpose of association. Study of disease should not be for the purpose of naming. If it is so, the name does harm. When you think of a child suffering from measles, the idea of measles may go out of mind, but the character of the sickness of that particular child must remain in the mind. So if we remember about measles, we may miss the patient. In measles, the individual case may differ from one case to another, but he is explaining. At first you will not be able to see what is meant by that, especially if you have been in the habit of studying cases for the purpose of diagnosis. I do not say this to throw a cloud upon diagnosis, but to show that the study of diagnosis is not for the purpose of making a prescription. The more you dwell upon diagnostic symptoms, the more you will becloud the ideas entering the mind that lead toward a prescription. Janta clear ga?
The quite opposite allopathy. Her diagnosis changed, but treatment starts in the
He is telling I am not against the diagnosis, but diagnosis is important, no doubt, but it should not be cloud, and it should not take hold about the prescription. Then the prescription will go wrong. You might go into the room and work an hour individualizing a case, deciding whether it were measles or scarlet fever. There are some confusing cases in the beginning. Well, you might say it is measles and must now have pulsatilla or scarlet fever and must have belladonna. So if you decide it is measles, you will think of pulsatilla. If you decide it is scarlet fever, you may think of belladonna. But you will not go through the symptoms whether the patient is having a pulsatilla symptoms or belladonna symptoms. So that is not important that he is explaining. Because if the rash is there with fever, the rash will be there. In typhoid also, some cases of typhoid in the first week there will be rash. So we may be confused whether it is typhoid or measles or scarlet fever, what it is. So whatever it may be, we have to study the case and then give the treatment. You will really see that such a state of affairs is misleading to the mind. If you are in an epidemic where it is necessary in order to save the neighborhood to know, for instance, whether a certain case of cholera or not, then it becomes necessary to do the two things. So to take care for about the other people, you have to know which disease it is. The family and the surrounding families are entitled to safety that a correct knowledge would give, and that protection, isolation and quarantine would afford. There are two kinds of study, one with a bearing toward the classification that the disease belongs to, and one with the reference for the remedy that the patient needs. So these two things are important in each and every case. But I prefer to settle the patient first as to the remedy he needs. So he says, I will give preference for that. And this has very little to do with the classification except in a general way. After a remedy has been decided upon that that clearly covers the symptoms and the patient receives his dose of medicine, the next point is what step is necessary to take in order to protect the people if this is a contagious disease. So first of all, you select the remedy, you give the dose to the patient, then you think of all the things, and then you can understand, and then you can study about the other things of isolation of the patients, the other people, and what care should be taken for the patient. Suppose if it is an infectious disease, suppose it is measles or chicken pox, you should instruct the patient not to take a bath and not to expose to the cold weather, not to take cold drinks, not to take icy cold things. Why? If he takes all these things, the rash will not come out. It will be suppressed and it leads to pneumonia or convulsions. When the rash gets suppressed, definitely it will lead to pneumonia or convulsions. Diagnosis is something that a physician cannot afford to be foolish about. He cannot afford to be a blunderer. He cannot afford to go around calling scarlet fever measles and measles scarlet fever. He should not get confused. He should not be so foolish. He must know enough about the general nature of the diseases that after the prescription has been made and the patient settled as to that, and the mother wants to know what is the matter with the child, to tell her for in that instance she has a perfect right to know. Naturally. If the patient asks, doctor, what is the suffering with me? What is the fault with me? You have to explain.
Definitely you have to explain. In the second paragraph, second aphorism itself is explained. You have to explain in a clear way about the process of cure and also the other things. So the patient may ask, so you should be in a position to explain. But if you are in a confusion, or if you are unable to understand, or if you are unable to diagnose, or if you are unable to know the condition of the case, how can you explain to the patient? You have to instruct, you have to explain. These are the things you have to take care. Normally, whatever the things, in some doctors they say, in jaundice cases, no, all the things you can give. There are no food restrictions. No food restrictions, nothing, no care should be taken. Everything can be eaten, including non-vegetarian, everything in jaundice. But it is highly dangerous to tell like that. Some doctors they state that jaundice is not at all a disease. It will come and it will go. So you need not follow the diet restrictions.
It will come, but the patient will go.
Definitely. Because of that misleading things, I saw 3 or 4 cases they have died because of jaundice. It was advanced to higher degree and finally they have died. Jaundice is definitely a disease, no doubt, and definitely care should be taken about the diet. Everything should not be eaten. We have to decide the diet basing upon the increase in which degree the jaundice is. Basing upon that we have to decide. To know about the degree of the jaundice, definitely we have to advise the patient to go undergo a blood test. Whether it is in the beginning or is it advanced, far advanced. Sometimes when it is much advanced also, care should be taken and diet only buttermilk and rice should be given, nothing should be given. So all these things are because of not following the diet restrictions strictly in jaundice. After certain years again the jaundice will recur. After 5 or 6, if first attack he gets in the 5th year or 6th year, definitely after 20 years he will get another attack and it will be complicated. And no doubt, whether it is HBS AG or virus C, they will normally we think that they will complicate, whatever it may be, but it will lead to many complications after some years. Wrongly treated jaundice will lead to cirrhosis of liver. So definitely it should be treated in a proper way. So you have to instruct the persons what care should be taken. That is a case where the family must be protected, where outsiders must be protected. The physician must decide whether it is proper for the child to go to school or whether it is not proper. Parents will ask, can we send the boy to the school even though he is having jaundice or even though he is having measles, can we send? Because if he misses the class, it will be a horrible thing. They will tell. But if he loses the health, it will be more horrible thing.
That point they should understand.
For measles or chicken pox, nothing should be applied externally. But normally they will advise, it should not be left like that. You have to advise you have to apply some lotions or ointments. Definitely it will lead to suppression. Because of that only in villages also nowadays, even in villages, not in cities. Previously in cities also it was like that, but now in villages they will not allow the doctor to treat if they have a suspicion that it is an eruptive fever, whether measles or chicken pox. The relatives of the patients themselves, they will say, no, we should not treat. They will say that the mother goddess will cause some wrong thing if we treat. So that is in vogue. Why it was so much popularized among the general people? Because even when the doctor will spoil the case, they will not allow the people will not allow the doctor to spoil the case. They will not give the medicines. But we have to educate them in one way. We should tell them we are not giving medicine for the eruptive fever, not to cure the eruptive fever. Only we are giving medicines not to be suppressed. This eruptive fever, if it suppresses, there will be danger in the throat or eyes. So to come out, we are giving medicine not to suppress. As long as the eruption will not come, the fever will not subside. So if we give some medicine for the high fever, definitely the rash gets suppressed. Then there will be much complications. But stupor will be there, drowsiness will be there, the lack of reaction in the patient. Again we have to go to the remedies like pyrogen or baptisia or ailanthus or antimtart or lacasis or zincamet or sulfur. There are some conditions of chronic diseases which closely resemble acute diseases. For instance, these mimicking acute attacks that come on regularly as periodical headaches. One attack singled out might have the appearance of an acute miasm, yet the tendency to progress and not to recovery shows that it belongs to the chronic class. Those disorders that come from debauchery and drinking and overeating from immediate circumstances that are periodical or things that arise from the latent psoric condition, they are momentary sickness. And if it were not for the fact that man suffers from chronic miasms, he would not have these. These attacks would not form a sickness, would not have an appearance of acute sickness. It is due to chronic miasms that man has these little recurring attacks. In acute attacks, also frequent acute attacks are due to the chronic miasmatic state in the patient. These do not come with a prodromal period, a progressive period and a period of decline. They may have an attack and a decline, but not a prodrome. The acute miasms, like the chronic, have the prodromal period. Para 72 says, relative to the first point, it will be necessary for us to enter here into some general considerations. The diseases of man resolve themselves into two classes, etc. Remember that the acute diseases always tend to recovery. The chronic diseases have no tendency whatever to recovery, but a continuous progressive tendency. They are far deeper miasms. There are three of these chronic miasms that belong to the human family, psora, syphilis and psychosis, and these we will take up and study. The worst cases are those wherein the three chronic miasms or some parts of the three have been complicated by drugs. When the effect of drugs has been removed, then we may begin to study the pure miasms themselves, but the miasms are complicated at the present day in most men, for whenever we come in contact with chronic sickness, we come in contact also with chronic drugging and its effect upon the vital force. So not only about the chronic miasms, not only complicated chronic miasms, but also that are complicated with chronic drugging, over-drugging. All of these will combine and form a complexity. I am of the opinion, perhaps I am wrong, that when bloodletting was in vogue, when violent cathartics were thrown in, when emetics and sweating were prescribed as in the olden times, when all these violent things were resorted to, the human race was not torn to pieces as rapidly as at the present day. So he is telling in those days the spreading and complexity of these miasms and speedy complexity of miasms was not so speedy. Now only it is more speedy, he says. The enormous closes of jalap and calomel rushed through the intestines and cleaned out the patient and he felt better afterwards, and probably did not carry to his grave the internal results of that cleaning out. He did not carry the internal results of the emetics and pseudorifics, but at the present day small doses of concentrated drugs are administered, which have an insidious effect upon the economy and develop their chronic symptoms very slowly. Those types of emetics and all those things, they used to be eliminated after some time. They were not carried out throughout the complete economy. But the remedies which are at present slowly when they are establishing their symptoms in the economy, slowly they are producing their own diseases in the economy, and gradually they are getting complicated. From the continued taking of old school products, the alkaloids, etc., we have the most dreadful state that has ever occurred in the history of medicine coming on. The aim is to get small doses to get an insidious effect. The milder preparations like sulfonal requires months to develop their chronic tendencies and are most vicious and troublesome drugs. So one may not suspect that these bad effects are due to those remedies, because immediately if a person is able to get the bad effects, then they can tell that is only because of using these medicines these bad effects are there, they are produced. But insidiously after some weeks or some months they are slowly developing. One may not be able to know that these bad effects are due to those medicines. The same is true with wrong using of homeopathic remedies, because the wrong use of homeopathic remedies, immediately they will not produce any bad effects. After some months or some years, the person may get horrible bad effects. The slow and subtle preparations are now being manufactured, and those seeming to produce a mild primary effect have secondary effects or after effects which are very severe. For example, in one place he says, Kant explains, when one remedy was invented, after injuring many millions and thousands and millions of people, then it will be abandoned, that saying these are the bad effects of that so and so medicine. For example, some psychic medicines which were being used previously, in previous days, after some time they were declared they were not to use those remedies because they were producing some bad effects. Similarly, some sleeping tablets which were there in the previous days, after experimenting and after using upon so many lakhs of people, then they banned that they are producing so and so bad effects, so these should not be used. Hahnemann said in his time, the most troublesome chronic diseases were those that had been complicated with drugs. So actual chronic diseases are a bit simple to tackle and to treat, because we can directly understand which miasm is there in that person, whether one miasm is there or whether two miasms are complicated or whether all the three miasms are complicated. That we will be able to know and start the treatment directly and simply. The process may be a little simple, but in cases where it is complicated with many drugs, wrong drugging and using many drugs, then only the question arises how to start the case, because the picture which we see, it will not be the direct picture and complete picture and true picture. So in those cases the selection of the remedy is also very difficult, and also to neutralize the bad effects of those remedies is difficult, and also to understand the case is very difficult, in which angle we have to study, from which angle we have to understand the case, and where we have to start the treatment. All these are the most troublesome things. If that were true, then it is 10 times so now. During Kant time he says like that, means now it is 1,000 times or 10,000 times to that.
Because corticosteroids are
The little headache compounds, the catarrh cures, etc., are milder as to the first effects, but more violent as to the last effects. They are prepared to imitate the palatable form of homeopathic remedies.